Is prostatitis an inevitable and untreatable scourge for men over 60, dooming them to endless discomfort and urinary woes? Or is it a manageable condition that modern medicine and lifestyle changes can conquer, allowing you to reclaim your vitality and peace of mind? This debate rages on in medical circles and among patients alike, with some viewing it as a natural aging inevitability and others seeing it as preventable through proactive care. Hello, gentlemen, on the Vital Men 60 channel. I am Dr. James Edward Carter, a urologist currently practicing at the Mayo Clinic and a member of the American Urological Association. I'm here to dive deep into the facts, backed by the latest 2025 research, to help you decide and empower you with knowledge to take control. I know dealing with prostate issues can feel isolating and frustrating, but you're not alone. Millions of men face this, and there's real hope. Let's unpack prostatitis step by step, from its roots to real solutions, with science, stats, and my personal insights to guide you. Common health issues in men over 60. Prostatitis, causes, symptoms, and treatment. Understanding prostatitis, what it is and why it matters for men over 60. Prostatitis is inflammation of the prostate gland, that walnut-sized organ below the bladder that produces fluid for semen and helps with urine control. It's not just one disease, but a spectrum of conditions, often lumped together but with distinct types that affect treatment. For men over 60, it's particularly relevant because aging increases vulnerability. Think of the prostate as a hard-working engine that accumulates wear and tear over decades. The National Institutes of Health, NIH, classifies prostatitis into 4 categories, as outlined in a 2025 update from the American Urological Association, AUA. 1. Acute bacterial prostatitis, ABP, a sudden infection, often from bacteria like E. coli, causing severe symptoms. It's the least common but most dramatic, affecting about 5 to 10% of all prostatitis cases. 2. Chronic bacterial prostatitis, CBP. Recurring infections, making up 5 to 10% of cases where bacteria persist despite treatment. 3. Chronic prostatitis chronic pelvic pain syndrome, CPPS. The most common type, 90 to 95% of cases, non-bacterial, involving ongoing pain without clear infection. This is where the controversy lies. Some experts argue it's primarily inflammatory, others link it to nerve or muscle issues. 4. Asymptomatic inflammatory prostatitis, detected incidentally during tests for other issues, like infertility or elevated PSA, with no symptoms but potential long-term risks. Why focus on men over 60? Aging thins the line between prostatitis and other prostate problems like benign prostatic hyperplasia, BPH, or cancer, which can overlap. In my experience helping patients virtually, older men often dismiss early signs as just getting old, delaying care, and worsening outcomes. But knowledge is power. Understanding these types helps tailor your approach. A 2025 review in JAMA Urology emphasizes that prostatitis isn't rare. It affects up to 50% of men at some point in life, but peaks in prevalence for those 50 to 70 due to cumulative factors like weakened immunity and urinary changes. Personally, I believe this underscores the need for routine checkups after 60. Don't wait for pain to dictate your health. Prevalence of prostatitis in men over 60. The numbers don't lie. Let's address the controversy head-on. Is prostatitis really as common as feared or overhyped? Data suggests it's widespread, but underreported, fueling debates on whether it's age-driven or lifestyle amplified. According to a 2025 study in Discover Public Health, prostatitis affects 2.2 to 9.7% of men overall, with a median of 8.2%, but in those over 60, rates climb to 10 to 16% due to comorbidities like diabetes and BPH. The RAND Interstitial Cystitis Epidemiology (RICE) study, updated in 2025, estimates 1.8% of U.S. men, about 2 million, have prostatitis-like symptoms, with older age groups hit harder, up to 15% in veterans over 60. In a landmark PMC analysis from 2025, chronic prostatitis prevalence is 1.8 to 8.2% lifetime, but for men 60+, it's closer to 11.5% for symptomatic cases, often coexisting with BPH, affecting 50% of men by 60. A Frontiers in Endocrinology report notes that while ED, related to prostatitis, hits 56.98% of men 60 to 80, prostatitis contributes in 25 to 50% of cases. Globally, a Wiley study warns that overlooking acute cases leads to chronic issues in 25 to 50% of lifetime sufferers, with older men at higher risk due to delayed diagnosis. In my opinion, these stats debunk the inevitable myth. Prevalence is high, but early intervention drops recurrence by 30 to 40%, per AAFP guidelines. If you're over 60 and experiencing urinary changes, I advise getting screened. It's not just stats, it's your quality of life. Causes of prostatitis in older men. Unraveling the triggers. The causes spark debate. Is it mostly bacterial, or do non-infectious factors dominate in aging? Science leans toward a mix, with bacteria playing a role in only 10% of cases, per Medscape 2025 updates. Bacterial causes. For ABP and CBP, culprits include E. coli, 80% of cases, Klebsiella, or Pseudomonas, often from urinary tract infections. UTIs, ascending to the prostate. In men over 60, catheter use or BPH obstructs flow, raising infection risk by 2 to 3 times. A clinical infectious diseases study reports 10% of prostatitis is proven bacterial, but in older men, it's higher due to weakened bladders. Non-bacterial causes, CP/CPPS, the majority involves inflammation without infection, debated as autoimmune, nerve damage, or stress-related. NCBI's 2024 book, updated 2025, links it to pelvic floor dysfunction, common in 60+ from sedentary lifestyles. Risk factors include prior UTIs, 15% recurrence in men, prostate procedures, or sexual activity. Transmitting bacteria, aging-specific triggers, reduced immunity, hormonal shifts, low testosterone, and BPH enlarge the prostate, trapping fluids and fostering inflammation. A Nature Prostate Cancer and Prostatic Diseases study finds CP/CPPS prevalence at 3.1 to 4.5% in young men but doubles in 60+ due to these. Environmental factors like dehydration or cold exposure exacerbate. In my view, the bacterial versus non-bacterial debate misses the point. Holistic causes mean holistic fixes. I recommend tracking triggers like diet. Many patients I've advised see relief avoiding spicy foods. Symptoms. What to watch for, and why they disrupt life. Symptoms vary by type, fueling controversy over whether they're real or psychosomatic in CP/CPPS. Acute cases are unmistakable. High fever, over 101 degrees Fahrenheit, chills, severe pelvic pain, and painful urination, affecting 5% of older men annually. Chronic symptoms are subtler but debilitating. Lower abdominal pelvic pain, 90% of cases. Frequent urination, up to 10+ times per night. Weak stream, and sexual dysfunction, like painful ejaculation. 50% overlap with ED. A Science Direct review notes urgency, incontinence, and back pain in 70% of 60+ patients. Quality of life impact. A 2025 Frontier study shows low QOL in CP/CPPS sufferers, with depression rates 20% higher. Example, a 65-year-old might skip social events due to urgency, leading to isolation. Personally, I think symptoms are underplayed. Listen to your body. If pain lasts greater than 3 months, seek help. Early action prevents chronicity in 40% of cases. Diagnosis. From exams to tests, getting it right. Diagnosis debates center on accuracy, as symptoms mimic BPH or cancer. Start with history and digital rectal exam, DERE, where the prostate feels tender, positive in 80% acute cases. Urine tests detect bacteria. Prostate massage for expressed secretions, EPS, confirms infection in CBP. PSA levels may rise, but not always cancer-related. Imaging like ultrasound or MRI rules out abscesses in 5 to 10% severe cases. The NIH Chronic Prostatitis Symptom Index, CPSI, scores symptoms, with scores greater than 12 indicating moderate severe. In older men, cystoscopy checks bladder issues. My advice, don't fear the DRE. It's quick and vital. I suggest annual urologist visits post-60 to catch early. Treatment options, from antibiotics to advanced therapies. Treatment varies, sparking debates on antibiotics overuse. For ABP/CBP, fluoroquinolones like ciprofloxacin for 4 to 6 weeks, curing 60 to 80%. Alpha blockers, tamsulosin, relax muscles, improving flow in 50%. For CP/CPPS, multimodal, NSAIDs for pain, ibuprofen reduces symptoms 40%, physical therapy for pelvic floor, effective in 70%, and antidepressants like amitriptyline for nerve pain. 2025 innovations, shockwave therapy improves pain in 60% trials. Surgery, TURP, for refractory cases, but rare, 5%. In my opinion, combine meds with therapy. Patients who do see 50% better outcomes. Prevention and lifestyle. Advice. Taking. Charge. Prevention. Hydrate. 2 to 3 liters per day. Avoid holding urine. Practice safe sex. Exercise reduces risk 25%. Diet. Tomatoes, lycopene, cut inflammation 20%. My personal tip, Kegel exercises daily. Strengthen pelvic floor, preventing symptoms in 30 to 40%. Personal opinions and advice. My take as your advisor. I've seen prostatitis rob joy, but also witnessed turnarounds. Opinion. It's not inevitable. Lifestyle trumps age. Advice. Track symptoms in a journal, seek support groups, and prioritize mental health. If acute, ER now. Chronic, holistic care. Conclusion. Empowering you against prostatitis. Prostatitis in men over 60 isn't a curse. It's conquerable with science and action. From 10 to 16% prevalence to effective treatments, hope abounds. I know it's tough, but you're resilient. Consult your doctor. Better days await. Age 60 is not the end. Take action to keep your sexual vitality alive. If you find this video helpful, like, share, and subscribe to the Vital Men 60 channel to get more reproductive health advice.